Hi, I'm Dr. Richard Busch, and you may recognize me. You probably have seen commercials from my office for the last 20 or 25 years. You've seen me interviewed on different radio and TV programs, and what we've been here to do is help as many people as we can avoid needless and unnecessary surgeries. Now, in the time of this COVID virus or the coronavirus, whatever you want to call it, obviously it's a very serious type of a thing, and we all have to take that seriously. Now, the thing is, as a chiropractor, my office is considered an essential business. It's been recognized that way both by the Department of Homeland Security and also the Indiana Department of Health. And so the idea here is, and what I want to kind of go over with everybody is, I want to talk about a couple of things and kind of let you know what we're doing here to actually help people. Okay, now the part that I can't stand talking about, but I think it's something that everybody needs to know, and everybody probably already knows at this point, but we have to go over it anyway. And that's practicing things like good hygiene, washing your hands, making sure that you're not touching your face after you touch different surfaces and that type of thing, keeping your fingers out of your nose, out of your mouth, and out of your ears and stuff like that. So those are different ways that some of these things can be traveled or transmitted. What we're doing in my office is we're actually working to even do a better job than we normally have done of disinfecting all the surfaces that might be available for not only the patients but also for our staff, because our staff is very important as well. So we want to make sure that we're practicing the good hydration, good hygiene. But then along with that, something else that's a pretty good idea is good hygiene, or good hydration. I'm sorry. As far as our bodies are concerned, they are a large portion water. And so we want to make sure that we have all the fluid in there that we can, and it's actually a good fluid to be able to help our bodies fight off any infection or anything like that might be coming along. Also along with that, something that's very important is social distancing. Now, the whole purpose behind that is if you get too close to somebody and they cough on you, or some droplets come out of their mouth or their nose, then theoretically speaking, that could be carrying the virus, and that could actually be a problem later on. So it's very important to make sure that we're keeping our distance. And in so doing, we've also made sure that we have a program where we can actually have our patients check in where they're online. They actually scan a QR code either at the front door. We've got one on a sign outside, or they can check in at the front desk. But the whole purpose for this is they can actually wait in their car, so they don't have to actually come in, sit in the lobby or the waiting room and actually be around everybody else that may be cross-contaminating. So it's something that's important to make sure that we're paying attention to. So we want to also, and I'm sorry, I've got some notes right here, but we also have worked to make sure that we've limited our staff so we don't have all the people that we normally would in here. I do think it's important to make sure that our staff is healthy as well as our patients. And so we know that if we get too many people in one area, theoretically speaking, we could actually transmit something to a lot of other people without even really recognizing or knowing it. So that's something that's important. We've also altered our hours a little bit. So if you are interested in coming in to see us, then please make sure you check either on Facebook or on Google. We're posting them in different places in other social medias. So the idea behind that is, again, we want to make sure that we're limiting the contact that we have with patients. So we're also limiting the number of patients that we have in the office at a time. And again, that's not only for our patient safety, but it's also for our employees' safeties. And then along with that, and this is something that goes along with our office being considered an essential business, what we're also doing, because we actually help patients with severe back pain or severe neck pain and a lot of other different, even chronic conditions, we're actually helping to eliminate or limit the amount of patients that may need to make an ER visit. So we actually see patients all the time that have severe back or leg pain or sciatic type pain. And so we are seeing new patients at this time as well. But we want to make sure that everybody understands that the patients that we see are going to need to have appointments scheduled, and we're going to have to make sure that it fits with the rest of our schedule. But I do think that it's very important to make sure that we make that distinction for people. And one of the things that kind of jumped out with me for that was the other day I saw a patient who had been scheduled for an epidural injection, and he had one. The epidural injection didn't help, and he was waiting to go back to either find out whether he was going to have surgery or whether he was going to have another injection. And they canceled his appointments, so he couldn't get back in. He's in a great deal of pain, didn't know what to do. And the neat thing about it from a treatment standpoint is we started working with him last week. He's actually already noticed improvement. So he's actually doing a lot better. He's a lot more comfortable. And so it's something that we're doing to help remove or reduce some of the stress that may actually be on the rest of the medical community around here. You know, we are here to help, and I think it's important for everybody to understand that. And again, just remembering the fact that what we're doing here, what I'm doing here, is I've dedicated my life to helping people avoid needless and unnecessary surgeries. And along with that, we want to make sure that we can help boost their immune system if that's at all possible. So we do some different things nutritionally to help with that. And those are things that you can actually check out here in our office, either before or after or during this whole situation. But along with that, we just want to help as many people as we possibly can with their quality of life and the situations that they're going through right now. So if you do have any problems or any serious problems, any exacerbations or anything like that, please make sure you give us a call. We are limiting the number of patients, so patients that would normally just come in for general treatment, we're actually working to spread them out as much as we possibly can and making sure that we're actually just really working with people who need it. But please give us a call if you need our help or if you need anything that we can do for you. Again, our number here is 888-471-4090. That's 888-471-4090. You can certainly click on one of the links through this article or through this the video. I'm sure that we should have one underneath here, or you can certainly give us a call. Thank you very much.